7 a.m. We're KUAM FM in Agana, Guam. We'll keep it in the KUAM News Zoom room where sanitizing duendes are wiping everything down with scented wipes this morning, antibacterial wipes. And we bring on from Catholic Social Services, she's the head there, Diana Calvo. Good morning, Diana.
Good morning.
Good morning. Can you hear me?
We can hear you. You're coming in fine. Good morning. How are you this morning?
Fine.
We wanted to bring you on, obviously, to talk about this, the homeless shelter. And there was I know that in talking with Mike, who runs the shelter up there, there have been some people who have had a hard time adhering to the different shelter rules and have been kicked out. And the most recent one that we had heard about was David Castro, who I understand was, I don't know, is the right word evicted, Diana, or kicked out? I want to use the right terminology here.
Well, I can't really say much about the client related issues. What I can say is that the evictions from the shelter is not is a last resort action. So on the last interview, I reported that we do have shelter rules, and it's primarily rules to maintain safety of all the individuals, including the employees. And if there are certain infractions, if you will, the staff will work with the individual units. But if it escalates or it endangers the safety of not only household members and employees, but also other individuals that might be in the surrounding, then we will take the strongest action, which is to evict the individual.
Right.
Can you provide us information on just how many people have been evicted to date? Or
So since we opened the dorm in June, at the latter part of June, there has been probably 5 evictions current.
is that like 5 families?
So the evictions have been on the individual who committed the incident, but for at least 2 of the cases, the whole unit, the whole family decided to exit the shelter. And the reasons on those evictions, 2 or 3 of them involved domestic incidences that were physical. We had one individual who, right when PCOR 1 was announced, he breached the compliance and said they were going to go to a site where we know that there were some COVID positive. It was related to a COVID positive death, and they would have had to quarantine if they were to come back, and he didn't agree to that, so the whole unit left. We had a couple that were evicted and eventually were arrested. One for damaging property, and it was actually a follow-up to a domestic incident.
Diana, so because I spoke with David yesterday, and if you guys had followed us, Link on Location, we went over to the Global Dorm. We interviewed Mike Suzuki, who's running the place. We interviewed some of the clients. We interviewed David Castro, who at the time was being housed at the homeless shelter with his wife and their young son now. I spoke with David yesterday, and he's not at the shelter anymore. But the concern I had, and I know this has been reported, was the boy, the son, right? So when you guys have to do something like evict someone from the shelter, what considerations are given, and do you kind of mobilize any agencies that may have oversight over, for example, I mean, you're evicting someone with a child and you know they're going to be out on the street. So at what point do we involve the, regulatory agencies like, I don't know, CPS, and because I know that's got to be a tough decision for you guys, right?
Yes, and so from the initial incidences and observations of our staff, including our social worker, if there are concerns about the welfare of children, then we will make a referral to CPS, and we have made referrals to CPS. And unfortunately, there's two things that don't happen concurrently or one affecting the other. And that is that when we make a CPS referral, we don't control whether or not CPS determines that referral to warrant an intake or an investigation. And if we have to take the drastic measure of evicting a family, then, they bring their kids with them, and that's noted. We've had other issues, even with homeless families, where for all of these, we do make referrals to child welfare services because it has to do with parents supporting their children and also placing them in a safe environment. And homelessness, whether you're at a shelter or on the street, will automatically warrant at least members of the coalition to send in a referral to child welfare services so they can ensure that the safety of that child is not being affected. And unfortunately, Chris, sometimes parents are not also being responsible about their own actions. And maybe they are, but, that's kind of like the consequence. And we have said that, we don't have authority to hold a child. So if the parents are not being parentally responsible, we don't have the authority to hold on to the child until CPS gets involved or we find other family members.
Diana, have you guys had any?
And it was on media that on the very first day when Global Dorm opened, that household was one of the first families to move into the dorm.
Right. Yeah.
So he's been there almost, they've been there about 5 months.
Diana, have you guys had any issues at the Global Dorm with mental health issues or even substance abuse problems? And if so, how did you deal with that?
Yes, and so there's two approaches. When a person, there's no drinking or use of alcohol or drugs or smoking in the dorm. We're not necessarily restricting that. They do those things outside. But if they were to come in drunk, we actually don't admit them. They're not evicted, but they're just not admitted to the door, into the complex. And so they can sleep it off outside. And that will minimize any kind of escalation of disagreements just because the individual is intoxicated.
Right.
We have had individuals observe to probably be depressed. We're not clinicians, but we do have new moms, and the staff has observed the mom not handling the infant appropriately. We have made referral, and we also recommended to the unit, to seek other services to help them. But it's also upon the acceptance of those individuals to want to receive the service. And so, yes, we have had incidences involving episodes, just I think last week we did call the GPD to come in to help control someone. And they exited the building and were causing other distractions to the neighboring areas, and that individual eventually was arrested.
Are you aware of any other shelters that are going to be open? Because I mean, we certainly appreciate everything you guys are doing and the OHAP and everybody else, but we're talking about only one shelter that has opened during this pandemic, and there are still hundreds more homeless people out on the streets.
Well, I think that the governor's office and the departments, they particularly with GSA, probably they're involved still in identifying or even negotiating with other landlords to expand the availability of individual units. But I don't have a sense of what the status is on that. What I do know is that most of the individuals that we're seeing even now on the street are new faces. And they're not necessarily some of the individuals that we have surveyed this year during our point in time count or in previous years. And so if these are new homeless, that could be an effect of being unemployed because of what's happening, and then eventually leave, or because there is an eviction moratorium. But these individuals are new to us within the homeless community, and so most of the individuals that are at Global Dorm are unemployed. We actually do have several that are working, and so they are leaving to go to their jobs and coming back. But we do also have individuals that have been long-term unemployed. And so those that have been long-term unemployed have really not worked for 5 years or more. So the individuals that are coming in would have the greatest need, yes, for housing, but they have the most barriers also. And unfortunately, the ones that may qualify for some kind of GORA housing, those are already in progress. But for those that have the greatest barriers, the stay will be quite longer as compared to other household units.
Diana, I know you don't have any stats on the new homeless, right? But do you have any idea about how bad it is? Because I know out here in the intersection, there's a guy who was a hotel worker.
Yeah, he's new.
And he's new, and we're seeing. I mean, I know it's anecdotal, but at some of the intersections, I'm seeing new people who are asking for money. So, do you guys have any idea how bad it is with the new homeless?
Well, the challenge that we have with, based on some of our intake, is that some of the younger homeless are also coping with the use of alcohol. And even at the dorm, we have observed individuals that appear to be under the influence. And so, if they're not belligerent, if they're not acting out or causing problems, they're pretty much left alone. But for the most part, particularly those who come in intoxicated, they're not good drunks, if you will. And, we can't afford to have any kind of interaction that will lead to an altercation. And then, we have a mixed census of adults and children. And so that can be done outside, and we will call the cops if we need to in order to bring control, but we will not accept them in. I also want to point out that if someone is not allowed in, it doesn't mean they're evicted. They can come back in when they're sober or when they've calmed down.
Right.
And even for those that have been evicted, they have the opportunity to reapply for readmission back into the dorm. They just have to go on the wait list.
Right. How long's the wait list?
Well, we are, if there's a unit that's available, we go down the list and we call people. And if they answer, then, they get admitted. If they don't answer during that day, we go to the next name on the list. And that's that process.
How many
I
names?
don't have an updated list.
Okay.
I don't have an updated count just because yesterday afternoon, staff were admitting people and there were also inquiries, so they didn't have time to update their list.
You think it's like over
But
50,
from the
50
previous
people?
week, I think we had, I think at minimum 15 households on the wait list.
Households. Diana, so you have a staff there 24 hours a day. You said a couple times that you've had to call the Guam Police Department. Is there any security there at the Global Dorm, like a security guard, anything? Do you guys need that? Do you feel like your staff is, I mean, they're not security guards, right? They're not referees, right? They're not bouncers.
No.
I mean, they
So-
play that. They probably do a lot of that. I mean, they do.
Mm-hmm.
You're telling us, but do you need that security?
There is no security at the facility. We do have some senior staff that we've placed at the dorm who have gone through crisis prevention and intervention training. Is really focused on de-escalating any potential issues. But if there are incidences, what we then react is everybody is advised to stay in their rooms while a staff is calling GPD. And as with some of our other sites, the precincts that's closest to us have been fairly responsive, unless they're all out on calls and stuff like that.
Right. Okay, Diana. Thank you for coming on and kind of going into that. And the takeaways are we have more homeless, and these are new homeless that you guys have not seen in the system. And
That's correct.
There's a wait list. At last we heard 15 households, which means kids, not just individual people, are on that wait list trying to get into the Global Dorm. We've heard from the Lieutenant Governor that they're having problems finding another shelter site. So he's supposed to come on tomorrow. We'll catch up with him on that. But Diana, thank you for your time.
Thanks, Diana.
Anything
You're welcome.
Anything in closing you want to add? Can you?
I just
Sorry, I want to because it's holidays. Are you guys doing any drive? Any donations accepting?
well, we're not initiating anything. Actually, the community has been very responsive, and I did want to acknowledge, the community's assistance, including some of the companies, both the wholesalers, I guess, and some of the retailers, for the stock inventory that they have, which are not selling. They actually have been donating to us, and we've been passing those out, including to Global Dorm, where we've kind of set up a little pantry for the families there to have access to snacks and things like that. And I think that we really, when some of the commercials come up and says we're all in this together, we really need to help each other, because there's a lot of families out there that are experiencing really real hardship.
Yeah.
And, we're focused on those right now that have either lost their housing, or, the stress from living in with families has caused them to move out and they have nowhere to go. And, those individuals who may not necessarily make the best kind of clients, but, we try to work with them, and there's multiple things that we're doing. And so we do appreciate, though, the support, not only for CSS, but specifically for Global Dorm, because we have had a number of families as well as organizations, initiate a drive to meet some of the specific needs. And that has been helpful also.
Diana,
Bring the stress down.
right. Before we
Yeah, I just wanted to follow up on everything that you just said. How we're all in this together, and there are people really hurting out there. Do you think the government has done enough, or do you think the government needs to step up and help more?
Well, being a retired GovGuam worker, when we've had periods of emergency disasters, that was island-wide. The pandemic brings on, really new challenges because it's a kind of emergency we can't see, except when people start to get sick. And so there's so many layers of work that needs to be attended to. And I think at this point, just from talking with some of my former colleagues who are still in GovGuam, we have staff who are pretty much exhausted. And we need to come up with a way to refresh, those individuals and infuse a way to re-energize, just because they're remaining dedicated to doing the work. But, if they don't get a relief just to take a break, there's going to be other impact, to the responders, just because they're having to attend to so many things.
Right.
And, I can't say I'm glad I'm not in government right now, because I can actually appreciate the kind of stress and all the multiple things they have to do. That's not only COVID, but they still have to administer their ongoing programs, and they have to kind of put a balance, on doing both. And if there are competing priorities, how do you identify what would be the higher priority?
Yeah. Diana, when we went out to a shelter, I know that they made a big thing about it wasn't just going to be a shelter. They were going to be offering different programs, passport to services, trying to guide some of these shelterees through employment opportunities, letting them avail of substance abuse treatment programs. Wraparound services. Has that been happening, or has it been affected by the PCOR 1 lockdown that we're currently in?
Well, at the beginning of PCOR 1, there were some delays in accessing services, such as with alcohol and drug treatment, even on the initial intake, and we were still trying to do a lot of things over the phone, but sometimes you just need to have that face-to-face interaction for some of the treatment services. And we have been bringing up some of those challenges, at least to the Lieutenant Governor's office, and trying to work with those agencies that have closed, to the public, and what are some workarounds that can be put in place to help at least some of those that are greatest in need. And, that includes getting GovGuam IDs at Rev and Tax, trying to coordinate inspections for housing for those that were actually lucky to come into public housing, or who do have Section 8 vouchers and are able to move into their own unit. Some of the delays are because those government agencies did not open to the public, and
Right.
so we're not going out into the field. Now that services are resuming, even though they're by appointment, they're starting to move, but we need to catch up, because we've lost 1 or 2 months in some of the access to services, especially.
Wow. So we'll follow up with Lieutenant Governor on that. Diana, again, thank you for your time. I know you gave us a lot of it, and you got to start your day, so we definitely appreciate it.
Appreciate you and everybody over there at Catholic Social Services.
Yeah. On your way out, grab
Thank
some of
you.
there's virtual malasadas and virtual empanada right there on the table if you want to grab it, okay?
Thank you. Have a good day.
Low
You
to
too.
no calories. Okay, Esther. I think she's on a diet. 7:25. We'll take a short break. We're coming back with Dr. Ho Wen, the chairman of the Physicians Advisory Group.